everyone. Happy afternoon, a very good afternoon. Am I audible and visible? A quick nod whether I'm audible and visible. Hello everyone, am I audible and visible? Please give me a quick nod. Hello everyone. Yes, I think it seems to work fine. At least the audio is fine, though the video might not be very good. All right, so happy afternoon, everyone. I hope and I believe all of you are doing well. And today in this session, this is next episode of NF100, which is FMGE Top 100 topics important for all the exams, be it FMG, be it NEET PG, or be it NICT, whatever exam it might be. So today we are going to simplify those confusing terms in PSM in fertility rates and fertility indicators. The general fertility rate, the total fertility rate, the gross reproduction rate, the net reproduction rate. All of these terminologies, tell me how many of you find that very confusing and difficult to remember actually. So we'll focus on the most important points on how to remember these terms and what are the potential questions that can be asked on these terminologies. Right? So, yes, plus subscription. I hope all of you are aware of it. Paid subscription, which gives you access to the structured courses on the platform. Iconic is Unacademy with Prep Ladder. And we have the new batch, which is coming up for NEET PG 2022, the fast track revision batch with MCQs, which is starting tomorrow, that is 1st of December. All the subjects will be covered with MCQs, the high yielding MCQs. And if you're planning to subscribe, you have an offer till tomorrow. That is, if you take 6 months subscription, you'll get 1 month extra. With 12, you get 2. And with 24 months, that is 2 years, you get 4 months extra. While subscribing, you can use the code Dr Nikita. That will give you additional discount while subscribing, right? So these are the various subscription rates. While subscribing, you can choose Plus or Iconic. Now coming to the terminologies. So we have crude birth rate, general fertility rate, age-specific fertility rates. Crude birth rate, as the term says, it's going to be a crude indicator of the fertility. It is the simplest measure of fertility, although its usage is unsatisfactory. Why? Because how do we calculate crude birth rate? You can get numerical based question as well on this. So crude birth rate means basically the number of live births. Number of live births per how many? Okay, number of live births per 1000 estimated mid-year population. So remember, basically crude birth rate is number of live births in the entire year upon estimated mid-year population into 1000. So basically it is per 1000 mid-year population. So live births in a year upon mid-year population into 1000. Remember, this is how we calculate the crude birth rate. Okay. So since in the denominator we have mid-year population, that is why it is unsatisfactory indicator of the fertility. General fertility rate, the difference is it is number of live births upon mid-year population of women in the reproductive age in that area in the same year. So basically the difference is the live births is there, but in the denominator we have females of reproductive age group multiplied by 1000. So when you get numerical questions, you get both in the data. Okay, so you will get that in an area, the number of live births in a year is this much, mid-year population is this much, the number of females in the reproductive age group is this much, married so many, unmarried so many, and they'll ask you to calculate the general fertility rate. So you should know that in the denominator for general fertility rate, it is the females in the reproductive age group, which is generally taken as 15 to 49. Okay, which is generally taken as 15 to 49. So of course, because in the denominator we have females of reproductive age group, that is why it is a better indicator as compared to crude birth rate. Okay, it's a better indicator as compared to crude birth rate. It's a better indicator, but what is the demerit? Not all women in the denominator, they'll be exposed to childbirth, right? Not all females 15 to 49, they will be exposed to childbirth. So that is not taken into consideration. So that is the demerit. I hope this is clear with everyone so far. So crude birth rate is crude. It is birth rate, so number of live births per 1000 mid-year population. It is general fertility rate. Remember, when it comes to fertility, we will include the women in the reproductive age group per 1000 number of live births. Age-specific fertility rates. Just that we have changed this general fertility to age-specific. So it is number of live births per 1000 women in a specified age group. Let's say 15 to 20, 21 to 25, something of that sort. So it is a more precise measure of fertility because you are including that particular age group, and it's a sensitive indicator of family planning achievement. So remember that age-specific fertility rates is number of live births in a particular age group, and in the denominator, it is mid-year female population of the same age group, right? So it is age-specific. Now coming to these which are more confusing terms, total fertility rate, gross reproductive rate, and net reproduction rate. Total fertility means the average number of children a woman would have if she were to pass through her reproductive years bearing children at the same rate as the women in each group now. So basically the total fertility rate tells us that a woman would have how many children, right? So remember, it is total fertility rate means total number of children, be it boys or be it girls. It is both, including male and female child, including both. How do we calculate total fertility rate? What is the formula? So basically we take the sum of age-specific fertility rate. So if you are given in the question that the fertility rate in 15 to 20 is this much, 21 to 25 is this much, 26, 30, like this you will be given. So you take the sum of all of them and you multiply by 5, depending on what is the group that is given. If they tell you 15 to 20, so you have 15, 16, 17, 18, 19, 20, so it's a group of 6. So you'll multiply by 6. Generally, the group is given for 5. That is why we take it as 5. Okay. So like 21 to 25. This is 16 to 25. 21 to 25, 5 years. 26 to 30, 5 years. That is why we multiply by 5. So you need to look at the group that is given the fertility rate. If it is given for 18 to 20, then it is given 21 to 23. So if it's given in the group of 3, 18, 19, 20, 21, 22, 23, then you'll multiply it by 3. So remember, this 5 is not constant all the time. Alright. So total fertility rate means the average number of children, boys and girls both, a woman would have. So what does it tell us? It tells you that the magnitude of the completed family size. A very, very important question and a frequently asked question. Which of the following indicates magnitude of completed family? Family will have both boys and girls, both children. So it's gonna be total fertility rate. Okay, so total is completed family size. Coming to reproductive rate, the gross and the net. Gross reproductive rate, remember G for G, it is the average number of girls. The boys are not included here. Average number of girls that would be born to a woman if she experiences a current fertility pattern throughout her reproductive span. Here you assume no mortality. What is the difference between gross and the net reproductive rate? Gross matlab grossly kitne number of girls would be born. Net matlab we need to do something minus, like we say net profit. If I earn 100 rupees, my loss is 20. The net profit is 100 minus 20, that is 80. If I say what is my gross earnings, that is 100. I'll not take loss into consideration. Same thing here. Gross means we do not assume any mortality, while in the net reproductive rate, we assume the current mortality rates. The mortality rates are taken into consideration in the net reproductive rate. So net reproductive, gross reproductive, it is the number of daughters or a number of girls. In the net reproductive rate, remember we take a newborn girl. The number of daughters a newborn girl will bear during a lifetime, assuming the present age-specific fertility and the mortality rates. Okay, so NRR is the best indicator. It's a demographic indicator. And when I say the net reproductive rate is 1, that means it is the two-child norm. Okay, that's a two-child norm. That basically the total fertility rate is 2. So when it is given that total fertility rate is 2, calculate the gross reproductive rate or the net reproductive rate. Remember that total includes both the boys and the girls. Reproductive rates include only the girls. So do half of that. TFR ka half 1 would be gross reproductive rate or net reproductive rate. Okay. So if they ask you to achieve the two-child norm, how much should be the net reproductive rate? It's gonna be 1. Okay, the number of girls 1, boys 1. So do half. If NRR is less than 1, then the reproductive performance is said to be inadequate. That means basically a one newborn girl should bear at least one daughter. That is replacing that newborn girl with another girl. Okay, so that is net reproductive rate. So if it is less than 1, that means a girl child is not giving birth to a girl child, then the reproductive performance is said to be inadequate. All these are the important points. So revising again, total fertility rate means average number of children. It is total. So both the boys and girls a woman would have. Newborn girl is in the net reproductive rate. After that, gross means you do not assume any mortality. Reproductive rate gross is girls. You only consider the average number of girls a woman would bear, assuming no mortality. Net reproduction rate is the average number of daughters a newborn girl will bear, considering the mortality rates. Okay, so the best is NRR. NRR 1 means two-child norm, and NRR less than 1 means it is inadequate. Okay, means it is inadequate. So look at the formulas which can help you in the numericals. Total fertility rate, basically it is the sum of age-specific fertility rate. If you are doing in the interval of 5, the age-specific, the group 15 to 19, 45 to 49, multiply it by 5 divided by 1000. That gives you total fertility rate. Okay, so basically the sum of age-specific fertility rate is total fertility rate. What is the difference between gross and total? Anyone? What is the difference between gross and total? What will be the change in the formula between the two? What will be the change? This is total fertility rate. This is gross reproduction rate. G for girls. When you say reproduction rate, you are looking at the number of girls only. Yes. So you need to look at the age-specific fertility rate for female live births only when you are calculating gross reproduction rate. So that's the difference between the two. In gross, it is only the girls. Okay, so age-specific fertility rate only for the female live births is what we need to consider. So why this is important? Again, in the numerical, they'll give you that overall age-specific fertility rate is this much. The age-specific fertility rate for female live births is this much. Calculate the GRR. You should know that you have to take this value in the formula. Okay. Tell me what will be the answer to this. So let us see some flashcards and some MCQs. Obtained by summing single year age specific rates at a given time is what? Is it GFR? Is it TFR? Is it NRR, GRR? What is it? What do you think would this be? What is obtained by summing the single year age specific fertility rates? So basically you are summing up the age specific fertility rate. Absolutely, that gives you the total fertility rate. What is general fertility rate? What is general fertility rate? It is similar to crude birth rate, except that in the denominator, what do we have in general fertility rate? We have the women of reproductive age group. Okay, so that is the difference between general fertility rate and crude birth rate. Okay, what is the answer to this? Number of live births per 1000 women in the reproductive age group. What does this define? Number of live births per 1000 women. So basically, live births upon women of reproductive age group into 1000. What is this? Very good, Arun. Absolutely right. That is general fertility rate, right? Dr. Grace, that is not crude birth rate, because in the crude birth rate, it is live births upon, in the denominator we have mid-year population, including both males and females, right? It is total mid-year population. This is women of reproductive age group. That is the general fertility rate. Okay, that's the general fertility rate. All right. Let's go to the next one. Crude birth rate is the simplest measure of fertility because it includes which of the following? What is included in the crude birth rate basically? Absolutely right. Remember, it includes the mid-year population. It is the number of live births upon a mid-year population into 1000. It's a crude indicator, simplest, mid-year population. Stillbirths are not included in the crude birth rate. It's only the live births. Okay, it's only the live births. Next one. What is birth rate defined as? Same thing that we saw, it is live birth per 1000 mid-year population. Okay, let us solve this question. In a community of 5,000 people, the crude birth rate is 30 per 1000 people. The number of pregnant females is how much? What do you think would be the answer to this? So, a very frequently asked question asked in one of the recent FMG exams as well. See, the crude birth rate is 30 per 1000 people. That means for 5,000, the total population, 1000 into 5, 5,000. 30 into 5, it is going to be 150 per 1000. So basically, the crude birth rate is 150 for this community. Okay. Now, the number of pregnant females. When you want to calculate the number of pregnant females, you have to add 10% for the pregnancy loss as well. Not everyone who is pregnant gives rise to childbirth. There are some MTPs, some abortions, some stillbirths, and all of that. So we have to add absolutely the pregnancy wastage, the pregnancy loss of 10%. So 150 plus 10% of 150, that is 15. So 150 plus 15, it is going to be 165. Okay, very, very important. So remember, it's going to be 165 to add that pregnancy wastage. Okay, not all the pregnant females give birth to a child. So that is why we have to add that pregnancy wastage of 10%. Okay, that is 10%. Next one. What is the denominator of crude birth rate? So these are all the previous year questions that have been asked. So you'll see quite a few repetitions to tell you that how from a same topic questions are asked in different formats. So denominator of crude birth rate is mid-year population, right? It is live birth upon mid-year population into 1000. It is per 1000. Which of the following is true about total fertility rate? True about total fertility rate is which of the following? Absolutely right. So, an example of a question where if you are sure that this is the answer, do not get confused with the rest of the options. We said that total fertility rate means total matlab completed family size. It includes both the boys and the girls that a woman will bear assuming the current fertility rates. So yes, it indicates completed family size. That is the answer. Rest of that, sensitive indicator of family planning achievement is age-specific fertility rate. Number of live births per 1000 married women in reproductive age group. That is not total fertility rate. It is number of births, average number of children that a woman will have of a reproductive age group. First of all, married is not included. It is the reproductive age group. And after that, number of live births per 1000 women in reproductive age group is what? Is it total fertility rate or is it general fertility rate? Number of live births per 1000 women in the reproductive age group is general fertility rate, right? It is general fertility rate. Average number of girls born to a woman, will it be GRR or will it be NRR? Will it be GFR? Average number of girls born to a woman, is it GRR or is it NRR? It is GRR. In NRR, net reproductive rate, we take into consideration the newborn girl, right? This is a woman, this is GRR. Next one, the number of live births per 1000 women in the reproductive age group in a year refers to which of the following? Absolutely right. So everyone got this right now. It is general fertility rate. It is number of live births upon the females of reproductive age group into 1000. That is general fertility rate. Total fertility rate is the number of children that a woman would have. Gross is the number of girls that a woman would have. Net is the number of girls that a newborn girl will have, taking into consideration the mortality. Okay, so the answer is GFR. Next one. If TFR in a population is 4 per woman, that means one woman on an average is giving birth to 4 children. What is the GRR approximately? If TFR is 4, what is the GRR? What will be the answer? Absolutely. TFR means boys and girls both. GRR means girls only. And it is going to be half of that. It is going to be 2. So be it GRR, be it NRR, where we are taking into consideration only the girls, it is half of TFR. Okay, it's a half of TFR. Okay. Next one. Approximate magnitude of completed family size is denoted by which of the following? Approximate magnitude of completed family size is denoted by total fertility rate, total marital fertility rate, general fertility rate or general marital fertility rate. Absolutely. Remember, it is total fertility rate, not the marital. Okay. So it is total fertility rate. Completed family size is total family. That is total fertility rate. Next one. This is multiple options correct. PGI type question. Total fertility rate, which of the following is correct? First, B option is correct. Yes, it's a measure of completed family size. Total fertility rate, yes, is the sum of age-specific fertility rate. So it's a sum of fertility of all ages. Is it the number of female child born to mother? No. Female is only GRR or NRR. This is to the woman, this is to newborn. Total number of children born to a woman in a given year, we do not consider in a given year in total fertility rate. It is in the entire reproductive age group. A woman of reproductive age group in her entire reproductive span, how much children she is giving birth to. So remember, it's not in a given year. So A is not correct. D is not correct. Total number of child born to a mother. This is a bit ambiguous because it's mother matlab we can consider women of reproductive age group. So this will be correct. If we consider that this is only married woman, then it might be incorrect. So I keep this as ambiguous, but I hope the concept is clear about the total fertility rate. Okay. Next one. Population growth is said to be less than adequate requirement when NRR is how much? Population growth is said to be less than adequate requirement when NRR is? What is NRR? It is the number of girls that would be born to a newborn girl, considering the mortality as well. Right? So if it is less than one female child not giving birth to another female, then that is inadequate. If it is less than one, then it is inadequate. So remember the replacement level of fertility. That is basically TFR of 2, that is half NRR of 1. That is the replacement level. So this is the TFR at which a newborn girls would have an average of exactly one daughter over their lifetimes. That means one girl giving birth to one girl replacing themselves. That is the replacement level. So that is NRR of 1. That means one girl is giving birth to one girl. That is replacement. If NRR is 1, then TFR is double. That is 2, approximately 2.1. So that is known as adequate level. Okay, that is adequate level. NRR 1 or TFR of 2, right? Which of the following indicators involve the reproductive woman? Which of the following indicators involve the reproductive woman? What will be the best answer out of this? Birth rate is mid-year population. General fertility rate is per 1000 reproductive females. So rest general fertility rate involves the reproductive woman. Okay, that involves the reproductive woman. So that is the answer. Next one, the denominator in general fertility rate is which of the following? What is the denominator in general fertility rate? Absolutely right. Remember, when we talk about fertility rates, you are including reproductive women in the age group 15 to 45 or 15 to 49. Okay, so it's not only the married women, it is reproductive women in that age group. Okay, mid-year population is included in crude birth rate. Next one, general fertility rate is indicator of complete family size, measure of fertility, not better than crude birth rate, or all of the above. Which of the following is true about general fertility rate? Absolutely right. Is it the indicator of complete family size? No. Indicator of complete family size is TFR, not GFR. Yes, it's a measure of fertility. Not better than crude birth rate. It is better than crude birth rate because crude birth rate is mid-year population. This is females of reproductive age group. So the correct answer is B. Absolutely right. Denominator in general fertility rate, you can see time and again this has been asked so many times. It is married women, women in reproductive age group, married women in specified age group, or women in specified age group. It is women in the reproductive age group, not married only. It is both the married and unmarried. Okay. So that is what is the disadvantage here, that not all females would be exposed to childbirth. Okay. So that is general fertility rate. Which of the following includes a mortality rate in it? Which of the following includes a mortality rate in it? Absolutely right. It is net reproductive rate. Net matlab including the loss. That means the mortality is considered. Net means the number of females that would be born to a newborn girl. So to call it adequate replacement, NRR should be 1. That means TFR should be 2.1. So remember that net is including considering the losses also, that is the mortality. So NRR includes mortality rate. The number of live births per 1000 women in the reproductive age group is, so a lot of revision. Number of live births per 1000 women in reproductive age group is That is GFR, right? It is live births per 1000 reproductive females. So it is GFR. Okay, so live births upon reproductive into 1000, that is GFR. Okay, that is GFR. For NRR to be 1, that means the adequate level, the replacement level, how much should be the couple protection rate? How much should be the CPR for NRR to be 1? Yes, it is 60%. Remember this number. For NRR to be 1, the couple protection rate should be 60%. Couple protection rate basically tells us the percentage of the married couples basically using the contraceptive devices. Okay, so that is couple protection rate should be 60%. 60 out of 100 couples should be using the protective measures. So that will give NRR of 1, 60%. What is net reproduction rate? Which of the following defines net reproduction rate? What do you think would be the answer to this? Absolutely right. Yes, Dr. Grace. So net reproduction rate, first it takes into consideration the mortality, right? Net is the newborn girl will have. Reproduction, wherever it is gross reproduction rate, net reproduction rate, we are looking at the girls only. So it is number of female children a newborn girl has in a lifetime, taking into account the mortality. So read the options very carefully. Option B says number of female children a newborn girl has in a lifetime, but mortality is not included here in the option. Option D has mortality also included, so that is a better answer, right? Remember, that is a better answer. So remember, it's a newborn girl, it is female children, and it takes into consideration the mortality as well. All right. Which of the following is the best indicator of fertility, which is a demographic indicator, the best indicator of fertility? The best indicator of fertility is net reproduction rate. Like net is mortality included, newborn girl giving birth to a girl in the lifetime. So that is net reproduction rate. That is the best indicator of fertility, NRR. Okay, NRR. Right, so that was about the fertility indicators. We saw the simplest is crude birth rate. Then you have GFR, age specific fertility rate, total fertility rate, gross reproduction rate, and net reproduction rate. Crude birth rate is per 1000 mid-year population, live births. This is live births per 1000 reproductive females. Age specific fertility rate is for that age group. It's a sensitive indicator of family planning attachment. And after that, you have TFR, total means completed family size. So average number of children that a woman would have. GRR, NRR is the number of girls, female child that would be born to a woman. No mortality considered here. Net is a newborn girl, taking into consideration the mortality. Okay, taking into consideration the mortality. All right. So I have summarized all the indicators that we just read. I hope this helps you understand the terminologies, and then you can remember what is included in which terminology. Okay. So that was about the fertility indicators. Very, very important. You generally get one question on this in your exam, be it FMG, NEET PG, INICT. It is important for everyone. Okay. So thank you so much everyone for joining in, and keep studying, keep revising, and keep winning. I'll see you in my next one. Thank you.